The Elder Care Protection Bill is now law. Here's what it truly means for you. Pause what you're doing, because something has just cleared the United States Senate and is set to affect your retirement, your health care, and your financial stability starting this year. Millions of retirees across the country still don't understand what's actually in it. We're talking about tougher guardrails against nursing home neglect and abuse, new boundaries on what seniors pay for prescription drugs, and updated rules that could put meaningful dollars back into your Social Security check. But here's what most mainstream coverage leaves out. Not every update happens automatically. Some improvements only apply if you know how to request them. And there are important deadlines you can miss if you wait too long. Today, we're going to translate the biggest pieces into plain English. No legal language, no partisan framing. Just clear information so you and your family understand what you may now qualify for and what you should do immediately to protect your future. Let's dive in. How this bill came to be. For decades, older Americans have been stuck navigating systems that often felt like they were designed for someone else. Prescription prices that were hard to justify, nursing homes operating with limited oversight, Social Security increases that didn't match real-world costs, financial scams draining retirees' savings. These weren't minor annoyances. They were serious problems quietly affecting millions of families nationwide. And far too often, lawmakers didn't give these issues the attention they deserved. The Elder Care Protection Bill is one of the broadest senior-focused laws in a generation. It reaches into the areas that matter most to people over 60: healthcare, housing, finances, and personal safety. And we need to go through details because headlines move fast and usually cover only the surface. The real value for you is in the practical details that change daily life. Prescription drug reforms. One of the most discussed parts of this law is prescription drug pricing. If you're on Medicare, this is the kind of change many people have waited years for. For a long time, Medicare was legally blocked from negotiating drug prices directly with pharmaceutical companies. Think about how unusual that is. The biggest buyer of prescription medications in the country could not use its size to negotiate lower costs. Private insurers could negotiate. The Department of Veterans Affairs could negotiate. But Medicare, serving more than 65 million people, could not. The result was seniors paying some of the highest prices on earth for the same medications people in Canada, Germany, or Japan often get for far less. The Elder Care Protection Bill expands and speeds up drug pricing reform. Under these new provisions, Medicare can negotiate prices for a much wider list of medications, and those negotiated prices will be applied faster than previous schedules allowed. In real terms, if you're paying $200, $300, or even $500 each month for medicines tied to diabetes, heart conditions, arthritis, and other common issues, there's a real chance those costs decrease, not in some distant future, but on a rolling timeline that begins implementation. The bill also places a cap on out-of-pocket prescription costs for Medicare beneficiaries, meaning there's a maximum amount you can be required to pay in a year, no matter how many medications you need. For seniors who've had to choose between filling prescriptions and buying groceries, that is not a small improvement. That is life-changing. Social Security updates. Now let's talk about Social Security because this is where emotions run high, and for good reason. Social Security has been the core support of retirement in America since 1935. It was built as a promise. You work, you contribute, and when your working years end, the system helps carry you. Over time, though, that promise started to feel less steady to many retirees. Cost of living adjustments, or COLA, are supposed to keep benefits aligned with inflation. Each year, the Social Security Administration looks at inflation data and adjusts payments. But the issue seniors have raised for years is this. The formula used to calculate COLA doesn't reflect how retirees actually spend. The standard method follows the spending patterns of urban wage earners and clerical workers, and it weighs categories like gasoline, electronics, and work-related costs. But retirees spend differently. Seniors devote far more of their budget to healthcare, prescriptions, and in-home support. And those categories tend to rise faster than many other prices. The Elder Care Protection Bill addresses this head-on. It pushes toward using an inflation index specifically built around senior spending patterns. That would mean your annual Social Security increase would better match what your life actually costs, not what a younger worker's lifestyle costs. Over time, that can add up to hundreds more per year staying in your pocket. It may not sound like a dramatic headline in a single year, but on a fixed income, an accurate adjustment year after year becomes real money. The bill also speaks to the long-running issue of Social Security's long-term funding. Without getting buried in technical terms, the worry has been that the trust fund could face depletion around the mid-2030s, which would create automatic benefit cuts under current rules. Nobody wants that outcome. This legislation includes measures designed to strengthen funding, largely through changes to the payroll tax cap, meaning higher earners contribute more, helping stabilize the program for everyone. That protects benefits not only now, but for decades. And if you have children or grandchildren who may rely on Social Security someday, this matters for them too. Nursing home reform. Next is nursing home reform, an area that still doesn't get the attention it deserves, even though it's incredibly important. If you have a loved one in a facility right now, or you're planning ahead for the possibility of needing that level of care, conditions inside those buildings matter. The hard truth is that nursing home neglect and abuse has been a persistent problem in the United States. Reports from the Department of Health and Human Services have repeatedly shown that many facilities have been cited for serious violations: understaffing, unsanitary conditions, medication mistakes, and in the worst cases, physical or emotional abuse. Under the Elder Care Protection Bill, nursing homes that receive Medicare and Medicaid funding, which is most of them, must meet stricter staffing requirements. The new rules set minimum staffing ratios, meaning there must be enough trained caregivers for the number of residents. That sounds like a technical detail, but in real life it means your parent has someone available to help when they need it, instead of one exhausted worker trying to cover an entire hallway alone. Understaffing has driven countless tragedies, and this bill directly targets that. Penalties also increase significantly for facilities that violate resident safety standards. In the past, fines were often so small that some chains treated them like routine business expenses. That changes here. Fines rise, and repeat violators can face the loss of Medicare and Medicaid funding, which for most facilities is essentially a business-ending consequence. That creates real financial pressure to follow the rules and treat residents with dignity. The bill also expands transparency. Facilities must make inspection reports, staffing numbers, and violation histories easier for the public to access. That means families can review real performance information, not just marketing materials at the front desk. Elder financial fraud protections. Now let's talk about elder financial fraud, which still doesn't get enough attention. This is a quiet crisis. Every year, older Americans lose tens of billions of dollars to scams and financial exploitation. The schemes vary: calls from fake IRS agents, Medicare scams, investment fraud, romance scams aimed at widows and widowers, dishonest contractors who take deposits and vanish, and even exploitation by relatives or caregivers with access to accounts. The FBI has repeatedly identified elder exploitation as one of the fastest growing crimes, and many victims don't report it because they feel embarrassed or overwhelmed. The Elder Care Protection Bill creates dedicated funding for prevention and prosecution. That means more investigators trained for these cases, more support resources for victims, and stronger coordination between federal agencies, state law enforcement, and financial institutions. Banks and credit unions are encouraged, and in some cases required, to identify suspicious activity in senior accounts and have reporting procedures in place for possible exploitation. That's huge because banks are often the first to see warning signs: a sudden large cash withdrawal, repeated wire transfers to unfamiliar accounts, or a new name added to an elderly customer's account. These are red flags. Under the new framework, institutions have more tools and more responsibility to respond. The bill also invests in public education aimed specifically at seniors. Because the truth is simple: knowledge is the strongest defense. When you understand the tactics scammers use, you're far less likely to become their next victim. Housing and aging in place. Now let's move to housing. For many seniors, their home is not just where they live, it's their biggest asset and the center of their life. Most people want to age in place, staying in the home they know, surrounded by their community and memories. But homes aren't always built for later stages of life. Stairs become hazards. Bathrooms without grab bars become accident zones. Narrow doorways become barriers to mobility. The upgrades needed to stay safe can cost thousands, and for retirees on fixed income, that money often isn't available. This bill expands support for home modification assistance programs. Through grants and low-interest loans administered locally, eligible seniors can get financial help for safety upgrades. Ramps, wider doors, walk-in showers, better lighting, and more accessible kitchens. These aren't luxury remodels. They're the changes that allow a person to stay independent and safe, rather than moving into a facility earlier than necessary. The bill also pushes affordable senior housing more broadly. It invests in increasing affordable housing designed for older adults, places built with accessibility, closer access to medical services, and more opportunity for social connection. Isolation is one of the most serious health risks for seniors. Studies have shown chronic loneliness can be as harmful as smoking 15 cigarettes per day. That isn't exaggeration. It's what research has found. By supporting housing that helps seniors stay connected, this legislation targets physical health and mental well-being. Mental health access. And speaking of mental health, something we still don't talk about openly enough. The bill expands access to mental health services for seniors on Medicare. Right now, getting therapy through Medicare can be difficult, costly, and limited. Many counselors don't accept Medicare because reimbursement is low, and stigma remains strong among older generations who were raised in a time when these topics weren't discussed. The bill works to reduce barriers by improving reimbursement and expanding telehealth, so seniors in rural areas or those with mobility challenges can receive counseling from home. Grief, chronic pain, fear of dependency, and loss are real burdens millions of seniors carry. Needing help with that isn't weakness, and this legislation pushes back against that outdated idea. Caregiver support. Now let's talk about caregivers because this often gets overlooked in policy, even though it affects tens of millions. There are an estimated 53 million unpaid family caregivers in the United States. These are spouses, sons and daughters, siblings and friends caring for aging loved ones while also working jobs, raising children, and managing their own health. The toll is enormous. Burnout is real. Depression is common. And historically, caregivers have received little financial help, limited training, and not much recognition. This bill changes that in meaningful ways. It creates new tax credits for family caregivers, allowing people who spend their own money on care to recover some costs through taxes. It funds caregiver training programs so families managing complicated medical needs at home can learn how to do it safely. And it expands respite care options so caregivers can take breaks without feeling like they're abandoning their loved one. A supported caregiver is a better caregiver, and that improves quality of life for seniors too. Everyone benefits. Medicare expansion progress. Now let's address another big topic tied to this bill: Medicare expansion, especially dental, vision, and hearing coverage. Original Medicare generally does not cover routine dental care, routine eye exams, or hearing aids. That gap is serious. Dental health affects overall health. Gum disease has been linked to heart disease, diabetes complications, and cognitive decline. Vision issues increase fall risk, accidents, and isolation. Untreated hearing loss is one of the strongest, modifiable risk factors for dementia. These are not cosmetic concerns. They are essential health needs. This bill makes real progress. A complete expansion remains politically complicated, but the legislation includes concrete steps forward. It adds new subsidies to help beneficiaries afford hearing aids, which can cost thousands and often aren't covered. It launches pilot programs that expand dental access through federally qualified health centers for Medicare patients. It increases funding for community vision services. It isn't everything advocates want, but it's meaningful movement in the right direction. What you should do right now. Now I want to shift to something that ties all of this together: staying informed. One of the most important steps after a law like this is understanding your own situation. What you receive now, what you may be newly eligible for, and what you must do to access benefits. Because as I said at the start, not everything is automatic. Some improvements require applications. Some require updating information with Social Security or Medicare. Some have enrollment windows you don't want to miss. Start with your local Social Security office or the official Social Security Administration website. If your state offers a Medicare counselor through the State Health Insurance Assistance Program, that's a free service in every state, and now is a great time to set an appointment. These counselors help people understand Medicare and navigate changes like these. They're free, unbiased, and designed for situations exactly like yours. And be careful. If someone contacts you claiming they can get you new benefits from this bill in exchange for money or personal information, treat that as a warning sign. Scammers move fast. Within days of major legislation, fraudsters build scripts to trick seniors into giving up Medicare numbers, Social Security numbers, or bank information. Real government help is free. SSA will not call demanding immediate action. Medicare will not ask for your credit card over the phone. If something feels wrong, hang up, close the page, and call the official number yourself. Final thoughts. Now think about your own life. Think about what has kept you awake at night, or the moments when you felt like the system wasn't built for you. Maybe it was standing at the pharmacy counter choosing which prescription you could afford. Maybe it was watching a parent struggle in a facility that didn't have enough staff. Maybe it was getting a bank alert about a transaction you didn't recognize and realizing someone might be stealing from you. Maybe it was sitting alone and wondering whether anyone truly understands how difficult this stage of life can be. This bill is not a magic fix. No single law solves everything, but it is a serious attempt to make the lives of older Americans better in real, practical ways. And more than anything, it's a message. A message that the Senate looked at the challenges seniors face and said, "We see you, we hear you, and we're going to act." After years of feeling invisible in policy conversations, that matters. There will still be fights ahead. Implementation takes time. Funding battles return every budget cycle. And the groups that benefit from the old status quo, pharmaceutical companies, understaffed nursing home chains, and financial predators, will not simply disappear. They will lobby. They will litigate. They will try to weaken progress. That's exactly why it matters that you stay informed, stay involved, and stay connected to what happens next. The strongest protection for any law is a public that understands what's at stake and refuses to let it be undone. Knowledge is power. Subscribe to my channel for more valuable content and make sure to turn on the bell.